Welcome to APM 84-016. The subject is illness amongst the fully substinated in 2021, which was folded into a narrative on breakthrough cases. This was the official COVID narrative's way of saying, yes, you got fully substinated, but SARS-CoV-2 or some variant of that virus broke through anyways. The substance in question is still safe and effective, but please keep masking and distancing, even if you have been fully substinated. That was the message. A quick note, whenever you hear that word substinated or the substance in question, what is really meant by that is as follows. And here follows proof of that narrative having been spun by U.S. government officials, including Tony Fauci and Rochelle Walensky, from the Epoch Times article, and I quote, starting with its title, 5,800 fully vaccinated Americans have contracted COVID-19, 74 dead. CDC, meaning this is what the CDC is telling us or admitting or acknowledging. Article by Zachary Stieber, originally uploaded on the 15th of April in the year 2021, later updated on the 21st of April, 2021. Continuing on with the article, nearly 6,000 Americans have contracted COVID-19 despite being fully substinated against the virus that causes it, federal officials said on April the 15th. The Americans contracted the CCP, or Chinese Communist Party virus, which causes COVID-19 break. So I'm going to just pause here in quoting the article. It's interesting that they're referring to SARS-CoV-2 as a CCP virus. This might be unique to the Epoch Times. In any event, we continue. And I quote, despite getting both doses of the Pfizer or Moderna substance or the single-shot Johnson & Johnson substance, the Centers for Disease Control and Prevention, known as the CDC, told the Epoch Times via email of the 5,814 fully substinated people who were confirmed as so-called breakthrough cases, nearly 400 required treatment at hospitals and 74 died. A little over 40% of the infections were in people 60 years of age or older, and 65% were female. The CDC declined to make a state-by-state breakdown available, though it has developed a national database where state health department investigators can enter, store, and manage data for cases in their jurisdiction. The CDC later posted a web page on the breakthrough cases. The figures were for cases through April 13th. We'll pause here just for discussion. So notice that by the 13th of April, the CDC has confirmed 5,814 COVID cases in the fully substinated. Now, presently, meaning October of 2024, if you go to the CDC website and enter as a search item, COVID breakthrough cases, it takes you to several links which include the following. COVID-19 vaccine breakthrough infections reported to the CDC, United States, January 1st to April 30th, 2021. And what we're going to find there is, and I'm quoting, a total of 10,262 SARS-CoV-2 substance breakthrough infections had been reported from 46 U.S. states and territories as of April 30th, 2021. So the Epoch Times article that is the focus of this broadcast is written at a time when they have information that takes us up to the April 13th. In other words, more than 5,000 COVID cases, and just a little more than 2 weeks later, by April 30th, according to information coming from the CDC, there's more than 10,000 cases. They've doubled in a 2-week period. So in 2 weeks, as the rollout of the safe and effective substance in question continues, what U.S. officials are calling breakthrough cases of COVID in the fully substinated have now doubled in just 2 weeks. And now returning to that Epoch Times article, and I quote, more than 78 million people have been fully substinated against COVID-19 in the United States as of April 15. Just a reminder that the number of breakthrough cases, according to the CDC itself, is about 5,000 as of the 13th or the 15th of April. That number will double in 2 weeks. Again, continuing with the Epoch Times article, to date, no unexpected patterns have been identified in case demographics or substance characteristics, the CDC stated. COVID-19 substances are effective and are a critical tool to bring the pandemic under control. All of the available vaccines have been proven effective at preventing severe illness, hospitalizations, and deaths. However, like is seen with other vaccines, we expect thousands of vaccine breakthrough cases will occur even though the substance is working as expected. CDC Director Rochelle Walensky stated during a congressional hearing on April the 15th that the causes of the breakthrough cases are being probed. Quoting Walensky, some of these breakthrough cases are, of course, failure of an immune response in the host. And then some of them we worry might be related to a variant that is circulating. So we're looking at both, end quote, she said. The number of cases the CDC has identified does not include people who contracted COVID-19 less than 2 weeks after their final dose, according to Walensky. In March, states began reporting numbers for people who had gotten infected despite full substination. Epidemiologists in Washington state identified 217 of the cases, 5 of whom died, fully substinated and now dead, 5. In Michigan, 246 of the cases were recorded between January 1st and March 31st. 3 of those patients died, fully substinated and now dead, 3 of them. Texas, South Carolina, and Oregon are among the other states that have reported more than 100 cases among residents. Washington State Health Secretary Umer Shah said in a statement, finding evidence of vaccine breakthrough cases reminds us that even if you have been substinated, you still need to wear a mask, practice social distancing, and wash your hands to prevent spreading COVID-19 to others who have not been substinated. He continues, we encourage everyone to get substinated as soon as they are eligible and encourage friends, loved ones, and coworkers to do the same. According to U.S. drug regulators, Pfizer's substance is 95% effective in preventing infection by the CCP virus. Moderna's was shown in a clinical trial to be 94.1% effective, while Johnson & Johnson's was 66.9% effective. The Johnson & Johnson substance was tested when variants were circulating, unlike the others. The percentages are based on results from substance recipients 2 weeks after the final substination. The percentage of substance breakthroughs in a population depends on multiple factors. I'll just remind my listeners that that term, vaccine breakthroughs, is referring to the idea that you had the substance, you're fully dosed, you got 2 doses of substance, but the SARS-CoV-2 or a variant has broken through. Whatever immunity or defense the substance allegedly gave you, it's broken through it. And Walensky is, in a sense, blaming the recipient that you failed to have the full immune response to that substance. So continuing on, we'll back up a bit. The percentage of vaccine breakthroughs in a population depends on multiple factors, including vaccine efficacy, the amount of virus circulating, and the length of time since substination, according to Natalie Dean, an assistant professor of biostatistics at the University of Florida. Says Dean, I love to see small numbers as much as anyone, but know that numbers like this cannot be directly interpreted as a measure of vaccine efficacy, although I have a feeling they will be. Break. We're going to pause in the middle of this quote coming from an assistant professor of biostatistics at the University of Florida. They seem to be saying that the raw data is not a sufficient means of measuring vaccine efficacy. One wonders how they came up with the motto, safe and effective, which has been in existence at this juncture in April of 2021 for some time. Now we're being told that they don't have sufficient raw data. These are small numbers. She continues, we can only interpret them against a background rate in unvaccinated people, end quote. Dean also wrote on Twitter, similarly, most breakthroughs have been in elderly adults, and these should not be read as the substance is less effective in elderly adults. The majority of substinations and the longest amount of follow-up time have been in elderly adults. Again, we need more info to interpret. Drawing from her language, we need more information to have an effective or accurate interpretation of a measure of vaccine efficacy. Again, so the question is posed, why have governments all over the world been telling their people that the substance is safe and effective. Efficacy is just a fancy word for effectiveness, when efficacy has not been borne out by numbers that are just not complete enough to lend to a credible interpretation. It is interesting that this assistant professor of biostatistics is saying, in regards to 5,000 fully substantiated people who allegedly now got COVID, though frankly that might have been a reaction to the substance in question, she says nonetheless, and I quote, "We need more info to interpret." Meanwhile, the CDC is stating, to date, no unexpected patterns have been identified in case demographics or substance characteristics. Dr. Anthony Fauci, the longtime head of the National Institute of Allergy and Infectious Diseases, stated in a briefing last week that the breakthrough cases are not a cause for concern. Quote, "I think the important thing is to look at what the denominator of vaccinated people is, because it is very likely, and what we're hearing, at least indirectly, and we're certainly going to be confirming that the number of individuals who were breakthrough infections is not at all incompatible. It's not incompatible with a 90+% vaccine efficacy." So on the one hand, a biostatistician is saying we don't have enough raw data to make any meaningful comments about efficacy. And here's Dr. Anthony Fauci saying, on the other hand, that what we're seeing, we expected to see this, apparently they never told us. That safe and effective narrative, that get the jab and get the job done, they never told us. Now, mind you, we are expecting a certain number of people to even die. It's called a breakthrough case. We never heard anything, but now we're hearing that they were expecting it. Although the narrative seems to be contradicting itself, because it seems to be significant, and we have to look at this, and we're looking at some information, demographics, but Fauci is saying we expected this. This does nothing to contradict a 90+% vaccine efficacy. Continuing with the article, so I don't think that there needs to be concern about any shift or change in the efficacy of the vaccine. Nothing to see here. Apparently they saw this coming. They knew there would be COVID cases amongst the fully vaccinated. I don't remember them mentioning that prior to the rollout of the COVID-19 substance. Perhaps what they knew is as follows. There will be adverse reactions to the substance in question. But you know what? We're just going to call those breakthrough cases. And from the Natural News website, an article posted on the 26th of April in 2021, and I'm quoting, CDC Director Rochelle Walensky told a congressional hearing on Thursday that the causes of the breakthrough cases are being probed. And I quote, "Some of these breakthroughs are, of course, failure of an immune response in the host. And then some of them we worry might be related to a variant that is circulating. So we're looking at both." She said, break. This was my earlier point. This appears to be a problem to the CDC Director, Rochelle Walensky. So we're looking into this, and we're looking at failure of an immune response, or we're looking at maybe this is a variant, a troubling variant. Well, Anthony Fauci is just saying nothing to see here. We expected this. Continuing with the article from the Natural News website, April 2021. The CDC is monitoring reported cases for clustering by patient demographics, geographic location, time since vaccination, vaccine type or lot number, and SARS-CoV-2 lineage. It has created a national COVID-19 vaccine breakthrough database where state health departments can enter, store, and manage data for cases in their region, end quote. I think it stands to reason, and this is me speaking now, that what is happening 4 months into the rollout of experimental substances in 2021 is as follows. That any adverse reactions to the substance in question is now being folded into a narrative on breakthrough cases, and they've even created a database for all of those possibly adverse reactions to go to. And the message is, there's nothing wrong with our substances. The host's bodies might have failed to have the right immune response, or it's another variant, and you can't blame that on our safe and effective substances. This is APM 84-016. Thank you for listening. Robert's out.